So dear students, can we start? It's R12 batch only, right?
Yes.
So since it is 1 hour class, we will not be able to wait long time for the others to join. So I think we will just start the class now. So before going into the technique, I just want to show some slides and show you what is the particular what is the technique. Then it will be easy for you to understand more. That way, so I'll just show you what is the technique. So when we are going into the technique, it will be little more easy for us. Okay. Are you viewing this video? Are you able to see
Yes.
the video?
Yes. Yes.
Yes, miss, but it's quite unclear.
Maitland techniques, and these are called passive.
So this video is just to show you what is the technique so that you can understand my remaining part of the theory.
Accessory intervertebral movements or patterns. And the first one we're going to perform is PA with the central vertebral going into a posterior anterior. So with PAVMs, when we're coming in, these are accessory motions that are taking place. You're going to get over the spinous process. I'm going to start at C2, and my thumbs are over the C2 spinous process, and I'm literally doing a posterior anterior displacement, mobilization. I go to the next spinous process, C3, do a posterior anterior, so on and so forth, all the way down the line. That is a posterior anterior central vertebral pressure. The next one we're going to demonstrate is going to be a unilateral PA. The unilateral PA, what I do is I find my spinous process, usually about a thumb's width away from that spinous process is going to be on that articular pillar, right where I want to be. This is called a posterior anterior unilateral vertebral pressure. And I stay with both of my thumbs over that area. Also, with PIVMs, you can have a transverse vertebral pressure. If I'm going to do transverse, I'm going to be coming along onto the side of the spinous process and do a transverse mob individually from C3, C4, C5, all the way down. We're going to show and demonstrate. This is usually done in prone. This also can be done in sitting. So if I have my patient in prone, I make sure that he's relaxed. I come off the occiput. I'm going to find C2. C2 is the process that's going to come up out at me. I get up over the top. My thumbs are on the C2 spinous process. I take up the slack and I do very gentle oscillations at the C2 level. I'm doing a central PA. Go to the next level, C3, central PA. Go to the next level, all the way down the line. I'm going to show you a unilateral PA. In this case, it's going to be a unilateral left. Find the spinous process of C2, and where I'm working is off of C2, C3. I'm going to find the C2 spinous process, put my thumb next to that. Just lateral of that should be the articular pillar that I want to be on. From that position, my thumbs are taking up the slack, and I'm pushing into posterior anterior direction. Go down to the next level.
Can you see this? This is
now I'm on C3, C4.
So this is the gliding what we are going to do for all the joints. So this is for this this is for spinal, but in our portion we will be learning for we will be learning for peripheral joint. Is that clear? So I just want you to see the video so that before the remaining theory, you will know a little bit what we are going to do. So this technique, as I said early, even though if there is five orthokinematic movement like spinning, rolling, rolling, gliding, and other thing, but most of the time we will be using distraction. We will be using distraction, compression, and sliding movement. So are you able to view my screen?
Yes, Miss.
You're able to view, right?
Yes, yes.
Okay. So most of the time we will be using sliding, compression, and distraction. Okay, the sliding is also called as gliding when you are going to treat the patient. So in the first picture, if you see, this is the compression. He is giving compression. Okay, in the second picture, if you see, this is called distraction. Okay. In the third picture, again, this is a gliding which he is giving, and this is also gliding, or you can also say as sliding. Okay, so this is the technique which we are going to see. So how we are going to do it, that only we are going to see now. So before going into the technique, there are two type of joint mobilization. So one is non-thrust oscillatory technique. Another one is non-thrust sustained joint play technique. So the first one is called as Maitland according to the person who has found it. The second one is Coltenborn according to the person who has found it. So now in this particular subject, we will be learning more about Maitland. We are not going to see about Coltenborn. We are going to see about Maitland. So in Maitland, there is non-thrust oscillatory technique means, so as the name suggests, we can say we are going to perform continuous oscillatory movement using osteokinematic and orthokinematic technique. Osteokinematic means our joint movement. Orthokinematic means the joint surface movement. Okay. So in this, like we will be using five different grades of movement. So the five different grades of movement will be like this. So for example, this is the articulating surface. This is the articulating surface space, or you can say the movement, the range of movement that is available in the between the articulating surface. Okay, so you can just see like this is the articulating surface. So in this articulating surface, because of any addition or because of any joint pathology, the space will be reduced. So the space will be reduced, and the available limit one is only this much. Can you see it? The available limit only is this much. So this is the tissue resistance. So in case if it is like that, so in this we will be able to use five different grades. The grade one is small amplitude. Small amplitude means small amplitude oscillatory movement. So it will be moving very mildly at the initial range of motion. It will not reach till the resistance. It will be just doing in the very initial range of motion. We will be doing the small amplitude oscillatory movement. Then the grade 2 is a large amplitude. It will go little bit deeper than the first one. So grade 2 is large amplitude. It will be going little more deeper than the first one, but still that will not reach the tissue resistance. Okay, so still it will not reach the tissue resistance. So this two grades we can use it to reduce pain and reduce pain. So the first two techniques will grades will be used to reduce pain. Okay. So the grade 3 is, again, this is also a large amplitude oscillatory movement, but this oscillatory movement will reach the tissue resistance. That means it will reach till the tissue resistance. So from the middle of the movement, it will reach till the tissue resistance. Okay, then so it is not like our normal range of motion where you will be seeing 0 to 70 or 0 to 80 degrees. This itself will be very lesser of movement. For example, hardly it will be there. The total distance itself will be around 2 mm or 3 mm only. Okay, in that 2 mm or 3 mm, in case if there is resistance between only 2 mm is normally available. In that 2 mm, you will be dividing like this and you will be giving the oscillatory movement. Grade 4 is again a small amplitude oscillatory movement, but it is given at the tissue resistant range. So given at the tissue resistant range. So grade 5 is very small, like again small amplitude, but it will be given beyond the tissue resistant range and it will be reaching the anatomical limit. And it will reach till the anatomical limit. Okay. So these are the 5 grades we will be using for Colton bone. So just to understand this, let me show you one more video so that you understand what is the oscillatory movement. Usually I'll be teaching this I will be teaching this with normally I'll be teaching this with
are a treatment intervention used by many physical therapists and other practitioners in order to address muscle spasm, reduce pain.
So usually I'll be teaching this with our skeleton so that you will understand it more. Okay, so but now we don't have options, so we are just going with videos.
Maitland's joint mobilizations are a treatment intervention used by many physical therapists and other practitioners. Maitland's joint mobilizations are a treatment intervention used by many physical therapists and other practitioners in order to address muscle spasm, reduce pain, and increase range of motion. Though it is not a perfect example, a group of staff. Maitland's joint mobilizations are a
He's giving it the knee, right? So that is the Maitland's technique. Okay, so I repeat the
treatment intervention used by many physical therapists and other practitioners in order to address muscle spasm, reduce pain, and increase range of motion. Though it is not a perfect example, a group of stacked sponges can help you visualize the various grading categories involved with these mobilizations. For reference, when the sponge is fully expanded, there is no pressure being applied by the therapist. When it is fully compressed, like so, we have reached the joint's limitation and the end of the available range of motion. This will be different for everyone.
This is what we say that articulating surface full range.
Grade 1 is a low amplitude movement starting at the beginning of the available range of motion. The primary purpose being the reduction of pain. Grade 2, on the other hand, is a high amplitude movement starting at the beginning of the range of motion just after taking up some slack and ending within the available range and not to the point of limitation. The purpose of this grade is also pain reduction. Grade 3 is a high amplitude movement beginning at about mid-range and going into the point of limitation. The purpose in this case is to maintain range of motion and possibly increase it. Grade 4 is a low amplitude movement performed at the end of the available range of motion and serves to improve the joint's range of motion. Grade 5 is a thrust technique that requires a lot of skill and practice. A high velocity, low amplitude movement is performed at the point of limitation and into the restriction in order to improve range of motion and possibly address pain. Here are some contraindications to this technique that you should be aware of.
So you understood the grades, or do you want to see it again?
See you again.
Okay.
Maitland's joint mobilizations are a treatment intervention used by many physical therapists and other practitioners in order to address muscle spasm, reduce pain, and increase range of motion. Though it is not a perfect example, A group of stacked sponges can help you visualize the various grading categories involved with these mobilizations. For reference, when the sponge is fully expanded, there is no pressure being applied by the therapist. When it is fully compressed, like so, we have reached the joint's limitation and the end of the available range of motion. This will be different for everyone. Grade 1 is a low amplitude movement starting at the beginning of the available range of motion, the primary purpose being the reduction of pain. Grade 2, on the other hand, is a high amplitude movement starting at the beginning of the range of motion just after taking up some slack and ending within the available range and not to the point of limitation. The purpose of this grade is also pain reduction. Grade 3 is a high amplitude movement beginning at about mid-range and going into the point of limitation. The purpose in this case is to maintain range of motion and possibly increase it. Grade 4 is a low amplitude movement performed at the end of the available range of motion and serves to improve the joint's range of motion. Grade 5 is a thrust technique that requires a lot of skill and practice. A high velocity, low amplitude movement is performed at the point of limitation and into the restriction in order to improve range of motion and possibly address pain. Here are some contraindications to this technique that you should be aware of.
Hey guys, thanks for watching. If you found this video helpful, you may also like some of our other videos right here and right here. And if you'd like updates on our newest videos coming out, please.
Okay, so did you understand what is the grade 1 and 2, how the oscillatory movement is there? So with the other videos, we will find it a little more easier to grasp the point. Okay, so just for the grade videos, I just want to show you how it happens. So grade 1 and 2, we will be using it to treat the pain, and grade 3 and 4, we will be using it to increase the range of motion. So in case if the first, that means the patient will be coming to you with pain only. So you will be assessing the patient. Then you will start with grade 1 and 2. In case if they have a reduced range of motion also, then you have to go from grade 1 till grade 4. Okay, so normally grade 5, we don't do grade 5 until and unless it is mandatory, and grade 5 is normally done by very experienced person, because sometimes when you give grade 5, it may break the bone. So you need to be very careful about grade 5. So grade 1 and 2 we will be using to reduce pain. Grade 2 and 3 and 4 we will be using to increase the joint motion, joint range of motion. So normally when a patient is coming to you with only pain, then you will be giving grade 1 and 2. If the patient is coming to you with pain and reduced range of motion, then you will be giving from grade 1 to grade 4. So this is about the Maitland. The next is the cotton bone. So it is, if you know both the grades, then it will be easy for you to differentiate. So cotton bone is like here, they will be using only orthokinematics. He will not use osteokinematics. But in Maitland, they will be using both ortho and osteokinematic. But in cotton bone, we will be using only orthokinematic. Okay. So here they have 3 grades. So grade 1 is small amplitude distraction. Grade 2 is enough stretch or glide. Grade 3 is large amplitude to place stretch on the joint structure. Okay, so same like the other technique, this also will be like in this also first 2 will be used for reducing pain, and third will be used to increase the range of motion. So this is the demonstration. So first it will be only a small amplitude will be done in the initial stage. It will not reach the tissue resistance. Second is again large amplitude glide, which will be done till the range of tissue resistance. Then grade 3 is again a large amplitude. It will be done. It will be crossing the tissue resistance and it will reach till the anatomical limit. So that is about grade 3. Since Colton bond we are not going in detail, I am not going to go in detail of it. We will just learn about Maitland's alone. So before going into the technique, we need to undergo proper evaluation of the particular patient. So without testing or without assessing the patient, you should not start the mobilization. And to do the mobilization also, you need to follow certain steps. So nearly we have 10 simple steps to follow before going into the technique. That means like during the technique, you need to follow this 10 steps. Okay, so first is you need to assess and you need to evaluate and assess the patient. So evaluate and assess, you can you will be having lot of other examination also. So along with that, this one also you have to evaluate. The main thing you have to evaluate is how is the pain limiting the range of motion. So definitely the patient will be coming to you with reduced range of motion. So they will not know that whether the problem is in the joint pathology or the problem is in the muscle or in the like in the opposite muscle group. So they will come to you with reduced range of motion. So you will be assessing, and once you find out the problem is in the joint cavity, then first thing you have to assess is how is the pain when you are doing the movement in the joint cavity. So you have to perform the movement, that is movement in the articulating surface. Then you have to find out uh, how much the tissue resistance is there, and during the tissue resistance, how is the pain. Okay, so these two things you have to assess. So you are going to assess the uh, range of articulating surface, how much is the tissue resistance and how it is affecting, whether the pain is before the tissue resistance or the pain is after the tissue resistance. Okay, so in case if the pain is before the tissue resistance, that means if the before you reach the end of the tissue resistance, if the pain is coming before and it is stopping the movement, then you have to do it very very gently. You should not go very hard or you should not stretch so hard. You have to do the oscillation very gently. Okay, so you have to start with grade 1 and you have to do it very very gently. You should not go beyond grade 1. Then in case if the pain and the tissue resistance are at the same time or at the same level, then you can go little bit do little more stretches, but you need to be very cautious. So that means you can go till grade 3, but you should not go to grade 4. You can do till grade 3. In case if the pain is after the tissue limitation, so that means till the tissue limitation there is no pain, then after that only if you have pain, then definitely you can go for a severe stretching, aggressive movement you can do. Okay, so here then you can go till grade 4, and sometimes if you want you can go to grade 5 also. So if the pain is before, then you have to go with grade 1. If the pain is concurrent, then you can go till grade 3. If the pain is after the tissue limit, then you can go till grade 5. Then next is joint position. So first is evaluation and assessing the patient. Second is joint position. Joint position means how you are going to position the joint when you are going to do the movement. So here like you have three types of joint position. One is resting position, then loose pack position, then close pack position. Resting pack position is in which the articulating surface will be more relaxed. That means it will not be stretched, but it will be relaxed. That is the capsule, the ligament, everything will be relaxed, and the joint surface also will be relaxed. There won't be any pulling or pulling pain, or there won't be any pain at all. So that is called as resting position. So most of the time we will be doing the movement, doing the glides in the resting position. Then slowly you will be moving towards close pack, or you will be moving towards the loose pack. Okay, so most of the time we have to do in the resting position. Then loose pack means the articular surface is maximum separated. So that means the capsule and the ligament will be stretched. So that is a loose pack position. So this position is like when you are giving traction, you will be coming to this kind of position. Okay, then close pack position means where the articulating surface will be closely packed together. That means most of the time it is together. There is no separation between the articulating surface. So that is called close pack position. Is it clear? Is it clear? So most of the time we will be doing the movement from the resting position towards the close back position. Then third point to follow is the positioning of the patient, positioning of the therapist, and stabilization. So positioning of the patient is very important because this is a gliding. You are going to give it for a little longer time, and you are going to give some force which might be a little bit painful for the patient. So you need to position the patient in a very relaxed position or in very comfortable position. Initially, you can start from loosely packed joint position. Then slowly you can go to close pack position. But most of the time, we will be starting the technique with resting position to evaluate and to start the technique. We will be going with resting position. Okay, so this is about the patient position. Then therapist position is also very important because you have to use some force and you are going to give continuous oscillatory movement. So continuous oscillatory movement means normally you will be doing 2 to 3 oscillation per second. Okay, in a 1 second you need to give 2 to 3 oscillation, and like that you will be giving for 20 to 30 seconds. So that means within 20 to 30 seconds you have to perform 40 to 60 oscillations. So you can just imagine how fast you are going to do the technique. So in this fast position, if you are not in a comfortable position, it is going to affect your body, as well as it will not be that much effective. So that's why you need to be very careful about it. So then that means the therapist should be in a walk standing position and which is comfortable, and you need to be giving the force from your shoulders. You should not give the force from the distal joint. So if you are giving from the shoulder, then it won't affect you, otherwise it will be affecting you. Okay, so this is about the position of the therapist and the position of the patient. The next, stabilization. So definitely in all the technique, the proximal joint should be stabilized. So if you're not stabilizing the proximal bone, then it will not be effective at all. When you are moving, both the bones will be keep on moving. So there won't be any movement and there won't be any improvement. So you need to stabilize the proximal joint. So how to stabilize the proximal joint means you can either use the hand stabilization, that is with one of your hand you can stabilize. You can use a belt, you can use an assistant to stabilize the proximal joint. So depending on the surface, if it is very big like hip joint and all, then you can ask any other person to stabilize the person. If it is very small, then you can use your hand to stabilize it. You can also use something called belt. So this belt is like how you will be you will be using to what to say, you will be like same your waist belt, but for therapeutic purpose we have this kind of belt. It will be same like your flight belt. So in flights, if you see, there will be a belt, right? Seat belt. So same kind of seat belt will be there, same kind of belt will be there, which will be helping you to hold the position. So next, fourth is what is the treatment force you are going to give and what is the direction of force. So first thing is like the force is applied as it should be along with the glide. With the glide, grade 1 or with the grade 1, 2, 3 or 4. So grade 1 and all, it will be very mild. Grade 2 will be little more stronger. Grade 3 will be little more. And grade 4 and 5 will be the severe one. So that is about the treatment force. So this treatment force, you can use your thumb. In case if not possible, you can use your hand. You can also use any flat surface which is available to give the movement, because sometimes if you are going to give for a very long time, it may be painful. So that's why you can also use any flat surface, okay, for giving the treatment force. Then the direction of the movement should be either parallel or perpendicular to the treatment plane. So parallel or perpendicular to the treatment plane means if the treatment plane is like this, like it's concave, and this is the treatment plane, then the gliding should be always parallel to the treatment plane. Okay, and the traction should be perpendicular to the treatment plane. Is that clear? So the gliding always will be parallel to the treatment plane. In case if the treatment plane is over the concave surface, but if the treatment plane is the convex surface, then you can give the gliding in perpendicular to the treatment plane. So depending on the articulating surface shape only, you have to decide the treatment direction. Okay. So next is regarding the speed, rhythm, and duration of the movement. So as I said early, this technique you need to give very fast. So normally you need to give 2 to 3 oscillation per second. So in 1 second you have to give 2 to 3 oscillation, and you need to give for 20 to 60 seconds continuously. So 2 to 3 oscillation per second means, so you will be giving from 40 to 100 times you have to give. Okay, in 1 minute you need to give from 40 to 100 times. So that much forceful oscillation you are supposed to give, or that much fast oscillation you are supposed to give. And like that, 20 to 30 seconds. After 20 to 30 seconds you give some rest, then again you go for the second set, then again third set. Like that you will be giving for 3 to 6 sets. Okay, so the frequency is 2 to 3 oscillation per second. Like that you have to give for 20 to 60 second, and after 60 second or 20 or 60 second you have to give some rest. That means few seconds of rest, then again go for the second set, then again third set. Like that you are supposed to give 6 sets of oscillation. Okay, so 2 to 3 oscillation per 2 to 3 oscillation per second. Like that 20 to 60 seconds you are supposed to give. Then like that you have to give 3 to 6 sets of oscillation. Okay, so you can just imagine how fast the technique will be and how smooth you have to apply. And all this oscillation you have to apply very smoothly, and you should give rhythmatically. Rhythmatically means the first second if you are giving 2 oscillation, then the second also 2 oscillation. So you should not mingle 2 or 3. So every second you have to give two oscillations. Okay, so that is called regular and rhythmic oscillation. And in case if the for painful joint, you can also apply intermittent distraction between the in between the oscillation. You can give distraction. Okay, so this is about the speed, rhythm, and duration. So next is so these are the 10 simple steps you need to follow. Is that clear? So these are the 10 simple steps you need to follow. So first is evaluate and assess the patient, and according to the pain you have to decide which grade you are going to start. Then determine the grades and the dosage. So grades, if you want to reduce the pain alone, then grade 1 and 2. If you want to increase the range of motion also, then you have to go from 1 till 4 or 5. Then third is position of the patient, which should be very comfortable. Then fourth is you have to position the joint, whether it is resting position or loosely packed position or closely packed position. Most of the time we will be starting the treatment with resting position. Then stabilizing, you need to stabilize the proximal joint. So since the movement is going to be a little bit faster and oscillatory, you can stabilize using any other devices like belt or any external person or external or your other hand. You can stabilize it. So definitely you need to stabilize the proximal joint or proximal articulating surface. Then only the movement will be effective. Then the treatment force. So the treatment force, again, it depends on how much which grade you are using. Then the direction of the force. So direction of the force, either it will be parallel or perpendicular. If it is like if the treatment plane is concave, then you should give parallel. If the treatment plane is convex, then you have to give perpendicular. So that is about the treatment direction of the movement. Then speed, rhythm and all. So speed and rhythm should be equal throughout or regular throughout the treatment. You have to give 2 to 3 oscillations per second, and like that you are supposed to give for 20 to 60 seconds. So after that time you give some rest, then again you can go for the second set. So like that you are supposed to give 3 to 6 set of time. Okay, so that is about speed and rhythm. Then again initiation of treatment, then reassessment. So after the treatment you have to go for reassessment every time. So after the treatment again you reassess, see how much it has improved, then send them home. So these are the things you are going to steps you are going to follow. Then while applying joint mobilization, you need to be careful that you are supposed to follow convex concave rule. Okay, for all the joint mobilization you have to follow convex concave rule. Okay, so convex concave rule is the concave part will be stabilized. So in that case, whenever you are doing the articulating surface movement, it will be opposite to the joint movement. So you need to keep that in mind and you have to follow that. Then the patient should be definitely relaxed, because it is going to be time consuming and it will be there for a little longer time. So you are supposed to be at a relaxed, comfortable position. Then explain the purpose and treatment of the treatment to the patient. Then the sensation to expect. So what are the, you have to explain them what are the sensation they will be expecting. Then evaluating before and after the treatment. So definitely you need to evaluate before and after. Then stop the treatment in case if it is too much painful. Use proper body mechanism for the therapist, because if you use improper, then you will end up in back pain or you will end up in some other problem. So you have to use proper body mechanism. Then you can use gravity to assist the mobilization technique. So you can use gravity so that the gravity will give you the distraction, and it will be the gravity will give you the distraction and it will be more easy for you to stabilize the patient. Okay, then last is begin and end the treatment session with grade 1 and 2. So begin or end the treatment session with grade 1 and 2. That is very, very important. Okay. Then what is the patient response? So immediately after the treatment, definitely the patient will be having muscle soreness. So why the patient is having muscle soreness means we are going to give a continuous kind of movement that is like irritating the muscle. So we are supposed to, so the muscles are supposed to go for soaring. So this is a expected one. So they will be getting muscle soreness. So you can apply ice or you can teach them how to apply ice and send them home. So most of the time these people will be at office only. Most of the time most of the time this technique will be like more painful only. So after the treatment also you need to give some pain relieving techniques like ice packing or any other thing. Then don't perform the joint mobilization daily, because it will be leading to so much of pain. So you have to you have to do alternatively, so that um, the soreness will reduce, then they will go for the next one, then next day you can go for the treatment. Then along after the treatment, definitely the patient should perform any active ROM exercise technique. So then only the patient will, it will be improving the muscle power. So definitely they have to undergo a active ROM exercise after the treatment. Then patient's joint and ROM should be reassessed after the treatment again and before the next treatment. So you cannot just directly start with the treatment session. You need to go for reassessing, and even next day when they come again you have to go for reassessing. Then pain is always your guide. When the pain is too much, you are supposed to stop. When the pain is so less, then you are supposed to continue the treatment. So the pain is a maximum guide which we are going to follow. Okay. So this one you can refer Caroline Christner book. I think you would have got the book already. If you don't have, you let me know, then I will upload in LMS. So we have another 15 more minutes to go. So So you can just have a 2-3 minutes break, then we will go to the next. Okay, so do you want to start the practical part now or next class? Because if I put one video itself, it will take more than 10 minutes.
Miss, we have class later at 4.
Okay, okay. So tomorrow freshly we can start the practical session. So I will be explaining the practicals through the slide, then I will be playing the video. So that it is easy for you to understand. Is that clear?
Yes.
Okay,
Yes, Miss.
thank you all. I will upload the slides. You can just go through before next class, and if you have any doubt, then we can discuss. So tomorrow you want to have 1 hour practicals or 2 hours? Okay, no problem. You can discuss later and let me know. Thank you.
Thank you.
Thank you, Miss.
Thank you, Miss.